Good Friday afternoon, ladies and gentlemen. My name is Adam Cooke. I'm coming to you on behalf of Telile Community Television with local analysis of today's Nova Scotia COVID-19 briefing involving Premier Tim Houston and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. A few people were caught off guard by this press briefing being announced just a few hours ago, especially since it's only 3 days before all provincial restrictions regarding COVID-19 are to be lifted, and the state of emergency that's been in effect for the past 2 years also is due to be lifted on Monday the 21st. But we started seeing some suggestions that not everybody is on board with the idea of masks being removed, in particular in Nova Scotia's public school system. We saw groups like the Nova Scotia Teachers Union and the IWK Health Centre in Halifax speaking out against this practice and encouraging that kids keep their masks on once the March break is over on Monday. And late last night, Dr. Robert Strang suggested that he might be on board with this suggestion as well. We're expected to get some kind of an update on that today, so we'll see how that goes. Right now, just before we get to the briefing, we'll provide you with some data. As you know, the daily data reports for COVID-19 in Nova Scotia stopped on March the 4th. They're only happening weekly now, and this particular update came 8 days later instead of 7 days later. So here's how things shake out. From March 9 to March 15, there were 2,888 positive PCR tests performed at the Nova Scotia COVID-19 lab. There were 41 new hospital admissions for COVID-19 and 23 discharges. And there were 15 COVID-19 deaths officially reported from March 9th to the 15th. As of yesterday, Thursday, March 17th, there are 38 people currently hospitalized for COVID-19 with a median age of 66. Of the current hospitalizations, 23.7% were partially or completely unvaccinated. The median age of COVID-19 reported deaths since the start of the Omicron wave on December the 8th was 79 years. And 24% of these were partially or completely unvaccinated. This can be compared to the median age of COVID-19 cases, which was 40 years overall throughout the pandemic. So there you have it, ladies and gentlemen. That's how things stack up as we get ready for the COVID-19 briefing beginning in mere moments, coming to you from Halifax. Once again, we thank the folks at Communications Nova Scotia and the province of Nova Scotia for making this briefing available to us to share with you. And we begin, as always, with remarks from the Premier of Nova Scotia, Tim Houston.
Thanks for everyone joining us this afternoon. Last month, on February 23rd, we announced that restrictions would end on March 21st. March 21st is now upon us. It's this Monday. And I can tell you that every day, really every day for the last 2 years, but certainly every day since February 23rd, Dr. Strang's team at Public Health, and now Minister Thompson's team at the Department of Health, and CEO Karen Oldfield and her team at the Health Authority, every single day, all these people are tirelessly analyzing the data, running what-if scenarios, and really managing the system. And I just want to say they've done an absolutely incredible job. There are many, many talented, dedicated people making sure that your safety is front and center. And all in all, I still believe that what was laid out on February 23rd was and is the right course of action for Nova Scotia. The Vax Pass is gone. People are back at games and events. Capacity limits are going. The state of emergency is ending on Monday, and restrictions, for the most part, are ending on Monday as well. And I know many of us are nervous about ending restrictions. I certainly am. For 2 years, we've been conditioned to be afraid and nervous, and that's a difficult switch to flip the other way. But being nervous is normal. And as my dad always says, if you aren't nervous, you aren't ready. But I will tell you this, we can move forward. Because individually we have the tools to make responsible decisions, not only for ourselves, but for those around us. We know what to do. And I'm hearing from people, I'm seeing them on the streets, I'm hearing from people all the time who tell me that they plan on continuing to mask. They've made that choice. That's the right choice for them and those around them. And this is good. It means people are prepared and they can make those decisions to protect themselves and their loved ones safe. We can also move forward because collectively, we've stepped up and have amongst the highest community vaccination rates in the country. That's something we can be proud of, and we shouldn't ignore that. But, and there is a but, there is a tweak to that February 23rd announcement. There's no playbook for managing this pandemic. We make the best decisions we can with the information we have in front of us at any given point in time. We agonize over every decision. I know Dr. Strang especially has carried an incredible burden for 2 years now. And today we have new information. When we have new information, we reassess. We've listened to consistently through the pandemic, not just me, but premiers before me and public health before me have listened to respected community leaders when they speak up. And this week, 8 leading pediatricians spoke up, and I've listened carefully to that. And after speaking with Dr. Strang and also reaching out to Dr. Link and listening very carefully, there is one update to Monday's removal of restrictions. We will be continuing to mask in schools until mid-April. School is essential. We've talked about this before and the high level of importance that I place on education and the level of importance I place on children being in school. So listening to these respected experts, it is clear that the best decision based on today's information is to keep masking in schools for now until the middle of April. So mandatory masking remains in schools, hospitals, long-term care homes, and jails, congregate settings. Elsewhere, everywhere else, it is strongly recommended that you continue to mask. You have the tools to make the right decisions. And just like when you're crossing the road, you make the responsible decision to look both ways. You don't need the government to make it mandatory to do so. You intuitively know the right thing to do. And I believe and have confidence that Nova Scotians intuitively know the right thing to do with masking. It's been a bumpy road, and there will no doubt be bumps along the way as we move forward, but we are on the right road. I am very confident about that, and there'll be bumps ahead for sure, but we're on the right road, and we should all have confidence in that. Dr. Strang, if you have anything to add.
Thank you, Premier. Good afternoon, everybody. This week is the second anniversary of the first cases of COVID-19 in Nova Scotia. And reflecting on that, my thoughts turn to all that Nova Scotians have been through together these past 2 years, and especially to the families who've lost loved ones. I also want to take time to thank the many healthcare workers, public health staff, colleagues in government, and others for their tremendous work and dedication and commitment to protecting the health of and wellness of Nova Scotians for the past 2 years. Today, we know from the data on our positive PCR tests that there is still a fair amount of virus out there in communities across the province. For most healthy vaccinated people, we do know that the Omicron variant will continue to be a relatively mild illness. But for some, based on age and underlying health conditions, getting sick means that they're at significant risk of being admitted to hospital, and sadly, some are still dying. The pandemic is not over, which means that the need for all of us to keep doing our part isn't over yet either. As most of our province-wide public health restrictions lift on Monday, it is even more important than ever to continue to do those things that we know work to keep us and others safe. They've worked for the past 2 years, and it's not time to let go of them yet. Masking will no longer be mandatory, everybody, but I still strongly recommend that you wear one in public places, especially indoors where you can't maintain at least 6 feet distance from people not in your close social circle. I strongly recommend that you keep rapid tests on hand and use them as a way to help protect the people you care about who are at higher risk. So we're certainly recommending, if you're symptomatic, to test. And if you're going to visit, let's say, an elderly relative in a long-term care facility, do a rapid test before you go visit. There won't be gathering limits anymore, but I still strongly recommend that you keep your gatherings small and your social circles consistent. Restaurants, bars, retail stores, gyms, large venues can all operate at full capacity beginning Monday, but I still strongly recommend that people make careful choices about where you go and that you avoid the kind of crowded indoor places that can lead to rapid transmission of the virus. And don't be surprised if some locations decide that they still want you to wear your mask. Any business or organization can make the decision, the policy decision for themselves, requiring people to be masked. And this is because, as I said earlier, COVID is still around us. And even though your risk may not be particularly high, the risk of people around you, the ones you love, and maybe the ones you don't even know, but they're your neighbors or your coworkers, may still be very high. And that's why restrictions will stay in high-risk settings like long-term care facilities and hospitals. And as the Premier said, we're also extending the masking requirement in schools for students, staff, and visitors for another few weeks, although all other school-related measures will end on Monday. This will help minimize spread as we bring back large groups of people together under a single roof with no other required public health measures. I also want to be clear that after March 21st, testing and isolation continue to be mandatory. I've heard some confusion about that. So certainly, if you test positive, whether it's a rapid test or a PCR test, you will still be legally required to isolate for a 7-day period. So people who have symptoms of COVID-19 will still need to stay home, do the online self-assessment, and book a PCR test if it's appropriate. And people who test positive, again, whether it's PCR or rapid, whether you have symptoms or not, if you're positive, you'll need to isolate for 7 days. These are very important public health measures that need to stay in place for some time yet. So the most important actions that individual Nova Scotians can take are to protect yourself and the loved ones around you and other people in your community. I've just outlined those, but another one is vaccination. If you're not fully vaccinated, it is not too late. And if you have a younger child who's ready for their second dose, please book that now. And if you're 18 or older and haven't gotten your booster dose, don't wait unless you've had a recent infection, and then you have to wait the 3-month period. But as soon as you're able to, and if you haven't had a booster yet and you're over 18 or over, please get it now. This will give you the best possible protection against COVID-19, and by protecting yourself, you're protecting others as well. I know that some Nova Scotians, lots of you are more than ready for the restrictions to lift, but others want to keep them in place for a little longer. This is an unsettling, uncertain time. And while there's still good reason to be cautious, there's also reason to have hope. The pandemic is coming to an end. As we lift restrictions, we all need to understand our own personal risk and the risk of people around us, and take the precautions that are right for our situation. These personal actions are also acts of kindness and caring to others. And I continue to be humbled by the kindness and compassion that Nova Scotians have shown for one another for the last 2 years. So let's keep that going. This pandemic isn't over yet. It will end. We have the tools to get through these last phase safely. And when the pandemic does end, let's have kindness, the legacy that Nova Scotia leaves behind. Over to you, Marla.
Thank you, Dr. Strang. Thank you, Premier. We'll now take one question, one follow-up from reporters in the amount of time that we have. We'll start with Jean Laroche with CBC. Go ahead, Jean.
Thanks, Marla. My question is for Dr. Strang. Yesterday, when you and I sat down to have this discussion about where we were at in terms of masking, yes, you did talk about the fact that you were going to highly recommend that people continue to mask up. But when it came to whether or not it was going to be mandatory in schools, you seemed to suggest that that was not necessary. What changed?
Simply the change that I had not yet been able to have a chance to have a conversation with the Premier. I've had through the last 2 years, myself, my public health colleagues have had ongoing dialogue with the Premier. Simply, we just had, because the Premier had been away, was traveling, we hadn't had a chance to have that conversation. So we did later on in the day, and this is the decision, the outcome of that conversation.
John, do you have a follow-up question?
I do, Marla. Dr. Strang, as you have said numerous times, children are at low risk of serious injury and death. They'll need to wear a mask to protect themselves and their classmates from this virus. Why are adults, particularly those who are at very serious risk of illness or even death, not given that same protection?
This is simply about where you break in schools. It's the number of people altogether that bring all their community exposures into one situation for prolonged periods of time during the day. So it makes sense to continue to have them masked as a way to slow down any potential transmission within that school environment, and then kids and teachers perhaps having to be off because they're now infected. This is a significant part of our commitment has always been to keeping kids in school, in class learning as much as possible, and that's the major rationale for this.
Next, we'll go to Callum Smith with Global. Go ahead, Callum.
Thanks, Marla. Premier, both you and Dr. Strang are obviously strongly recommending folks still mask up. Many public health experts outside of that are doing the same. I guess you say folks know what to do, but what's the harm in continuing with masks until the end of the respiratory season?
In fact, there is no harm. That's why we're recommending that people make the decision to do that. I think the distinction is making it mandatory. And I think, look, it's been 2 years. We're looking at a lot of factors, certainly weighing the mental health of people, looking at what the science is telling us, and people, if they're comfortable wearing a mask and want to wear a mask, they should absolutely wear a mask. And if they're around people who are, at a higher risk or in a big group, wear a mask. There's absolutely no issue with wearing a mask. We strongly recommend that people continue to wear a mask, but there's lots of things that government strongly recommends people to do, and they don't have to make it illegal for somebody doing the opposite. With 2 years of experience, with 2 years of knowledge, with 2 years of focus on the pandemic and doing things that Nova Scotians can do to keep themselves safe, I believe that they know what to do.
Do you have a follow-up question?
I do, thanks, Marla. And just on that point, Premier, I understand you say it's been 2 years and we know what to do, but if that's the case, why did we have a mandate from the get-go? I just wonder why that in particular is not continuing if the recommendation is so strong to continue to do so.
Oh boy, imagine how much has changed in the last 2 years, Callum. I mean, we didn't even have a vaccine 2 years ago. Right now, we have almost 92% of Nova Scotians that are vaccinated. So there's a lot that's changed over the 2 years. I think that the response of government and certainly here in Nova Scotia, Dr. Strang's leadership and the team at Public Health, we make the best decisions that we can make at a certain point in time. And I think really world-renowned response for the response from Public Health here in Nova Scotia. But as things change, vaccination rates change, people's understanding of the virus changes, the virus itself changes, and so we recommend that people continue to mask and do what they can and what they know is necessary to keep their families safe. I just don't think it's necessary any longer for the government to make it illegal to not do so.
Next, we'll go to Heidi Petracek with CTV. Go ahead, Heidi.
Thanks, Marla. I'm just wondering, the timing of this. Would the pediatric physicians, the advisory group, not have been consulted ahead of time or earlier when it came to masking in schools, or is there a disconnect there? And when they put out their open letter, suddenly the change has to be made.
No, I don't think there's definitely not a disconnect, and it's certainly not a sudden. I know Dr. Strang is in constant contact with a number of medical colleagues. And I guess what I would take some responsibility for is I was kind of out of the province on some business, and by the time we had a chance to really sit down and really look at the information that's in front of us, this is a decision, and it's the right decision.
Heidi, do you have a follow-up question?
I do. Just wondering, when we look at other countries around the world who have gotten, loosened restrictions or eliminated restrictions, cases have gone back up. How prepared is this province to deal with that if it occurs?
I mean, if Dr. Strang, if you want, but I think what I would say just is like every population is so unique. I mean, there's different vaccination rates, there's different demographics. So, I mean, certainly there's you know, we're keeping an eye on data elsewhere, but I mean, I don't think you just need to take one and transpose it over the population of Nova Scotia. But Dr. Strang.
Yeah, no, I had this question. I did a number of interviews yesterday, and you have to be careful comparing one country to another because, as the Premier said, there's all sorts of different factors about what type of public health measures they've used, what is the vaccination rate, what was even the schedule of vaccines and the interval between different doses. All have impacts upon what's the underlying immunity and lasting immunity in the population. So we'll certainly continue to monitor where we're at, looking both at our case rates, but even more importantly, as we've done for now the past couple of months, really looking. The most important thing is where we're at with our hospitalizations, and are we seeing what is the rate of severe illness? I'm not as worried about cases. What I'm much more concerned about is what are the numbers of severe illness through hospitalizations that we're seeing. So we'll continue to monitor that, and as always, and the Premier knows as well, I will monitor this, and we'll on constant communication with him, and we'll bring forward our assessment of that and our recommendations as necessary. As I said, we're not out of the pandemic yet, so public health still has a role in surveillance and monitoring and bringing forward our best public health advice.
Next, we'll go to John McPhee with the Chronicle Herald. Go ahead, John.
Thank you. Dr. Strang, you say that we should avoid crowded indoor places, and yet we are lifting all gathering restrictions on Monday. The word disconnect was used earlier, and there does seem to be a disconnect between what you're saying and what's going to happen on March 21st.
No, I don't think so. I think it's more around we have to lift restrictions, all the impacts, financial, mental health impacts of restrictions are significant. What I'm saying to people all ultimately make their own choices based on their own level of comfort. But I'm saying we're still in a pandemic that going into a crowded indoor space, especially if there's a lot of other people in very close contact and lots of other people being masked, people need to be aware that is a higher risk situation.
John, do you have a follow-up question?
Yes, I do. Thanks. This is again for Dr. Strang. If you say the pandemic is coming to an end, I know that it's kind of an indefinite sort of statement, but when you look at the case counts and the subvariant fears in a lot of countries where this pandemic originally began, and then the wave of cases came our way, I'm just wondering, what's the reason for your optimism that the pandemic is coming to an end soon? Or can you put a date on that in terms of that statement?
No, nobody has a crystal ball, and maybe it's really we're moving into a different phase, but it's a substantive change in our phase. That it's the pandemic. All pandemics end. We don't know exactly when, but what they do is they kind of there's not like a one day where all of a sudden the pandemic's over. You make this transition where the virus is going to continue at some level, but you adapt, and society and communities and families and people learn to live with that, have the right level awareness and protection, but without having all the stronger, more mandatory restrictive measures that were necessary for the first couple of years. That's the big change we're making. And then moving into the future where we still have to be very cautious, and public health will continue to advise people about what level of caution they need. It's likely to be different once we get into summer, and then it might change again in the fall. But again, it's much more around going to be relying on what choices we have to make to help keep ourselves safe and others safe, but without the more stronger measures. Those are always in our toolbox, but I can only see going back to those if we had a substantive new variant that would almost be like starting the pandemic over again. And I even hate to say those words.
Let's go to Tim Bousquet with the Halifax Examiner next. Go ahead, Tim.
Hi, Dr. Strang. We've 15 deaths this past reported week, 16 before that. Are we going to continue to see this number of deaths going into the future?
So it's important to understand, and I've said this many times, that deaths actually reflect the activity of virus about a month ago. So the deaths that we reported this week and last week, early March, they really reflect what was going on early February. So we will see. One of the things we're watching is as our hospitalizations have been going down. They're now plateauing a bit as we reopen. We'll watch that carefully. But we look at hospitalizations and deaths. But again, I think it's important for people to understand that the time lag deaths really reflect what was happening with much greater levels of virus circulation around a month ago.
Tim, do you have a follow-up question?
I do. I would just quickly comment that you said that a month ago too, and same general death level. But moving on, data. I understand why you went to weekly. Reporting makes sense, but the status, the quality of the data has declined immensely. And doesn't that make it difficult for people to be fully informed about how to live safely?
So we've adjusted, and we heard over the last week, and I believe just within the last hour or so, we've got a number of new graphic ways to portray case rates and hospitalizations and trends over time through the Omicron wave. That those are now live on our dashboard.
Next, we'll go to Lindsay Armstrong with the Coast. Go ahead, Lindsay.
Thank you very much, Marla. I understand there were about 300 healthcare staff off work earlier this week due to COVID. I'm wondering, Dr. Strang, if you can tell us a little bit about what kind of impact absences of that number has on the system.
So I'm not directly involved in the operations of providing healthcare, and certainly that number has come down substantively, but it is still 300 people that could otherwise be working. So certainly it's one of the factors that continues to put pressure on the delivery of healthcare, and we have to keep an eye on that, along with a number of other factors.
Lindsay, do you have a follow-up question?
Yes, thank you. Are you anticipating, or are you sort of planning to cope with having a potentially higher number of healthcare staff off work as restrictions are removed?
You'd have to ask that question directly to the health authority. I think they're looking at a number of possibilities and adjusting to things. But to further comment on your question, this is why one of the factors that we need all Nova Scotians to continue to do what we're asking them to do. Take COVID seriously, follow all those personal preventive measures, which are critically important to helping continue to limit the spread of the virus, even as we necessarily reopen. We never know when we're going to need access to healthcare, and we need to start to be able to open up our healthcare system as soon as we can to other types of non-COVID healthcare. So all Nova Scotians have a role to play by doing all the measures that the Premier and I are strongly recommending in the weeks ahead, because that contributes to protecting our healthcare system.
Okay, next we'll go to Pat Healy with the Laker. Go ahead, Pat.
Hi, this question for Premier Houston. With the announcement here today of the masking still continuing in schools, some people will see this as the province backpedaling on removing all restrictions. What do you say to those people?
It's a pandemic, and pandemics are unpredictable by their nature. So I think as a province, we've always been honest about what's the right decision at a given point in time, based on the information at that point in time. So look, we're gonna continue mandatory masking in schools. That's the right decision for the province, based on all the information we have, and there will be many people that agree with it and many people that disagree with it, but that's not what's driving the decision. What's driving the decision is what's the right thing to do for Nova Scotians, and that's why it's being made.
Okay, let's move on to Lois Ann Dort with the Guysborough Journal. Go ahead, Lois Ann.
Yes, hello, thank you. The stealth Omicron variant is fueling China's biggest outbreak since the start of the pandemic 2 years ago, a population that is also 87% fully vaccinated. How are your feelings about this as a cause for concern?
So what we know is that the BA2 variant it's a cousin of Omicron. It's still the current vaccines provide the same level of protection against that variant as against Omicron, and so that's one of the reasons we're saying we've done a good job after Christmas on really getting our boosters into people, especially older adults. We still need younger adults, 18 to 50, or need to we need more work to do to get more of them with their booster dose. So the vaccines continue to be what protects us, whether it's against Omicron or this cousin of Omicron. And we have all the other measures which which protect us, everything we've outlined: masking, staying home if you're sick, all those other measures, limiting your social activities, social circles. Those protect you no matter what variant is there. So we have all the tools, and we'll continue to monitor things. But I'm not overly concerned about the cousin of Omicron having any greater impact than Omicron is currently having or has had.
Lisanne, do you have a follow-up question?
Yes, please. Thank you. Is the government currently monitoring for the stealth Omicron variant, and will the public be notified if it is found?
Well, we have actually had one case which we reported on. I think it was 3 or 4 weeks ago of that new variant. And yes, we continue to monitor and do testing both locally to look at the variants that are strains that virus that it isn't readily identified as a known variant, and then those ones will continue to send samples off to the national lab. So short answer is yes, we are monitoring for it, and we have had one case to date of that latest variant.
Okay, let's move on to Adam Cooke with Telile Community Television. Go ahead, Adam.
Thank you very much, Marla. Dr. Strang, I'd like to ask you, how much does the case of the immunocompromised and the immunosuppressed factor into the current strategy for testing and monitoring COVID-19 in Nova Scotia? And further to that, what do you say to those within the immunosuppressed and immunocompromised community who have concerns with the swiftness of regulations being changed this coming Monday?
Well, there's a lot in that. First of all, with the people with underlying health conditions, one of them being immune compromised, they're the group that we have maintained all along that they need to get a PCR test, because they're at a group where it's much more important to know for sure, have the most accurate test possible. So we have looked at that as part of our testing strategy. We've also made sure that those are groups with meet a certain definition of immune compromise. We've said follow the NACI recommendations, and they should have 4 doses, not 3 doses of vaccine. So we're making sure that they're following the expert advice on protection through vaccine for those groups. But that's the second part of your question is at the heart of why we need all Nova Scotians to still take COVID seriously and to follow all those personal measures, because while they protect you, they're as important, they're protecting others around you. There are always people in our community, well before COVID and well after COVID has gone. There will always be people for one reason or another that are more vulnerable to whatever kind of infectious disease. And so they always need the rest of us to be careful to help them to remain safe. And right now, COVID has highlighted that need. And so that is why, a key reason why everybody needs to keep doing what we're asking them and strongly recommending to do, because you don't know for sure who in your family, who in your social circle or at work may be one of those immune compromised people, and they're relying on you to get vaccinated to wear a mask.
Adam, do you have a follow-up question?
Yes, I do. Thank you, Marla. I'd like to ask as well, Dr. Strang, what is the state of current PCR testing? We have been advised to continue to have rapid test kits available at home for us to test with, but where and how far widespread is PCR testing in Nova Scotia at this stage?
So we're still maintaining our 30 plus access points, the Nova Scotia Health Authority for PCR testing. We still have our groups. All the information is on the NSH website that, where there are certain groups that I just referred to that are because of age or underlying health condition, we're recommending that they get a PCR test. Other people who are symptomatic, we're saying use a rapid test. But now we also have the option that if people have a a positive rapid test, they have the option of then going quickly and booking a confirmatory PCR test. And for rapid tests, we have broad access to rapid tests at a number of community access points across the province. And again, all that information is on both the government and the Nova Scotia Health Authority website. So we have lots of access to both PCR and rapid testing.
Next, we'll go to Blair Rhodes with CBC. Go ahead, Blair.
Yes, thank you. My question is relating to the masking policy that's going to be continued on Monday. The masks are being kept on in schools. Why not in daycares?
So that is simply the daycares are a smaller environment. They're much more in, even a larger daycare has really much more defined and restricted cohorts of much smaller groups of kids, and also there's more challenges in daycare age children around wearing masks, and we've always accommodated that. So our for example, our public health order, we've always had the clause that said that children 2 to 4 years old, that it's okay for them to not wear a mask if their parent or caregiver is having challenges of getting them to wear a mask.
Do you have a follow-up, Blair?
Yes, we've managed to see some Nova Scotia health documents here at CBC about positivity rates for COVID testing that are ranging between 19 and 26%. And another document says that the risk of infection is severe in all 4 health zones. Why isn't that sort of information not being shared with the general public?
So first of all, the percent positivity is very different, and the reason for that is that once we made it available for people who already had a positive rapid test to get a confirmatory test, our percent positivity rate, because of that change, went from around 10 to 12% to the numbers that you're seeing. So that is the reason for that change in percent positivity, because we now have, and we look at it periodically. Some days it's as much as 60% of the cases that we're reporting as positive PCR previously had a positive rapid test. So that right away, the likelihood of your percent positivity is greatly skewed because of that. So I really don't watch the percent positivity anymore because of that factor. The risk levels that the health authority uses are very different from the risk levels than public health use it, because they're based on what they need to do in terms of infection control and occupational health precautions within the health environment, which is much more or a much lower risk tolerance of bringing virus into those facilities. So their use of the words risk related to community risk of virus is very different definition from what the public health and the work that I do and my team looks at.
Okay, we have one final question from Sarah Savonsky with All Nova Scotia. Sarah's having mic issues, so I'm going to read her question. Do we expect cases and deaths to increase or stabilize with restrictions lifting? Are we expecting a number of deaths will become commonplace in a world where we're living with COVID?
So we know from, and I've talked about this publicly, from national modeling now, which was about a month ago, clearly showed that as you open up public health, lift public health restrictions, you will see more cases, and there's a possibility of having more hospitalizations, and therefore there's a possibility of having more deaths. But so that's why we're continuing to say those are possibilities, the more severe disease. So we're going to watch that carefully. But a lot of that is that's why we need people to continue to take this virus seriously, to do the things that limit the spread of the virus in the community, that protect those, especially those who are most vulnerable for severe disease.
Great, thank you. And that's all the time we have today. Thank you everyone for joining us. Have a great weekend.
And there you have it, ladies and gentlemen. Not all that much changing over the next couple of days, but we are getting more recommendations from public health and from the Premier to wear masks in more situations, particularly in public schools, in hospitals and other health centres, as well as Nova Scotia jails. The state of emergency is still coming off as of this coming Sunday night at 11:59, 1 minute before midnight. Most restrictions are going to be lifted by Monday, March the 22nd, but schools are still going to be asking students and their staff to wear masks both in school and on school buses until the middle of April. There's a lot to digest here and a lot that wasn't actually discussed within the COVID-19 briefing, so I'm going to try to help you through in terms of what's expected of us as of this coming Monday. This is from the Nova Scotia government press release that came out just as the media briefing was starting. So, effective 12:01 a.m. this coming Monday, March the 21st, there will be no gathering limits or capacity limits. But people should still keep their social groups small and consistent and make careful choices about the gatherings they attend. Physical distance will no longer be required between individuals and groups, although distancing is still recommended. Masks will no longer be required, but wearing one in indoor public places or crowded outdoor places is strongly recommended. Businesses and organizations across all sectors can resume full operations with no mandatory public health restrictions. Special events including festivals, sports, performances, meetings, training, and faith ceremonies can resume in full. Now let's look at the education system more carefully. In public schools, staff and students will follow the updated guidance in the Back to School plan, including the following. Masking for staff, students, and visitors remains in place for a few more weeks during school hours and on school buses. Visitors and spectators will need to wear masks in schools during school instructional hours for a few more weeks. Staff and students are asked to follow core public health measures such as getting vaccinated if eligible, staying home if feeling unwell, following the COVID-19 daily checklist, washing and sanitizing hands frequently. Music, band, arts, and sports in schools can resume in full. Tournaments, concerts, and extracurricular activities are permitted, and planning for graduation can proceed. And if you'd like to know more about exactly how things are going to shake out in the public school system over the next few weeks, check out the web link novascotia.ca/backtoschool. In long-term care facilities, residents can have 5 visitors at a time if the facility can accommodate them. Larger groups of visitors are permitted for special occasions like a resident's birthday or anniversary if the facility can accommodate them. Visitors need to wear a mask and be fully vaccinated except for end-of-life visits. And regardless of vaccination status, residents can leave the facility for any reason, including overnight visits with family. The Nova Scotia Health Authority and IWK Health Centre will continue with mask requirements and visitor restrictions. Anyone with symptoms of COVID-19 needs to self-isolate, complete the online self-assessment, and book an appointment for testing. People who are at increased risk for severe disease, live in congregate settings, or are integral to keeping our health system running are directed to book a PCR test. Everyone else is directed to use rapid tests. People who test positive on a rapid test can book a PCR test to confirm the result. Speaking of rapid test kits, people should keep a rapid test kit at home in case they need it. Rapid testing can help protect people at increased risk of severe disease, such as people who are older or immunocompromised. Rapid tests continue to be distributed through schools for this purpose, and they're available in many community locations. And last, people who test positive for COVID-19 are still required to self-isolate for 7 days from the date symptoms started, or from the date of a positive test if there are no symptoms. There are no requirements to notify contacts outside a person's household, but people are encouraged to do so, especially for those who are at increased risk. Contacts are not required to isolate as long as they are symptom-free and test negative, whether they live with the person who tested positive or not. So there you have it, ladies and gentlemen. Even with few changes coming, there's still a lot to digest, as you can see. So be sure to check out novascotia.ca/coronavirus, as well as the link novascotia.ca/reopening-plan. And once again, just a reminder, if you have any questions concerning the back-to-school reopening plan and how masks are going to be used, we ask you to check out the website novascotia.ca/backtoschool, all one word. And of course, if you have any questions or concerns concerning the progress of the COVID-19 reopening strategies here in Nova Scotia, or about the general monitoring of the disease by Nova Scotia Public Health, please feel free to contact us here at Telile Community Television. You can contact me directly. My phone number is 902-625-8863. My email address is adamjrcook, Cook with an E, @gmail.com. You can also reach Telile Community Television directly. The station phone number in Arichat is 902-226-1928, and you can reach Telile by email using the address telile@telile.tv. We will also be keeping you up to date on COVID-19 regulations and the changing regulations on our social media feeds. We're on Facebook, Twitter, Instagram, and YouTube. Our YouTube channel, in addition to these COVID-19 briefings, will also feature updates on COVID-19 through our regular programming, Telile 24/7, Roundtable, and Notre Côté. That wraps things up for this afternoon, ladies and gentlemen. I'm Adam Cooke. Thank you for joining us here on the Telile YouTube channel for an update on the COVID-19 briefing held earlier today by Premier Tim Houston and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang.